Hi, my name is Jason. I'm a paramedic nurse, and in the last 6 or 7 months or so, I have had 4 spinal surgeries at Bonati Spine. And this video is a review about the process and what happened to me and how I felt throughout the process and how it ended for me in a 5th surgery with another doctor that had to go in and fix what was not done properly in the Bonati surgeries. And when you go to Bonati, they're very, very tight on what they say. They have a very narrow path, right? They don't believe in fusions. And I had an L4 L5 fusion 25 years ago. They don't believe in fusions, even though that fusion was my 3rd surgery 25 years ago, and it lasted. I'm a paramedic nurse. I was lifting people off the floor. That fusion was the best thing that ever happened to me. I got hurt just bending over and stretching. Like I was just trying to loosen up. I was just trying to limber up a little, and I blew out a disc just bending over stretching. It was bad. I was twisted. I was bent over. I was on 10 milligram Percocets a day for the pain. I was still doing my work. Clearly I wasn't lifting anything, but I was still sitting at a chair doing an hour or so worth of work a day, even on the Percocets. But it's a very narrow range of information that they give you, all designed to lead you to use them as a service. It's a business. You can't fault them for that. I'm a paramedic nurse. I was in so much pain. I did almost no research because it was so long. And my first doctor, Dr. Muir, he decided that I didn't need surgery. I needed more diagnostic testing. And meanwhile, I'm bent over, I'm twisted, I'm on 10 perks a day, I'm walking with the cane, I can't sit up, I can't lay down, I'm twisted. I was probably 4'10". I was so bent over. And so he decides I don't need a surgery. They're going to keep doing diagnostic testing. And then they stop their relationship with the insurance company. So they dropped me as a patient because that wasn't their insurance anymore. And this is what they told me. The doctor's PA, the one who I saw, this is what he told me. We'll be dropping the insurance in a couple months. I thought they would get the surgery done. So now I'm off. I don't have another insurance doctor at the moment. I'm suicidal. The pain is so overwhelming. It is amazing how the base of your spine is connected right to your entire brain, and that the pain can be beyond overwhelming. And so they're very narrow with what they tell you is good and bad, right? They say like rods and pins and hardware. This is bad. Statistically proven over time. Is it? Yeah, possibly. For me, it was brilliant. Way better than the Bonati surgery, which never worked for me. None of the 4. And so they tell you that they're going to do a disectomy, right? And they go through like a little straw, a real small hole. They don't dissect the muscle from the bone, which is what you're seeing in this video right here. This was muscle dissected from the bone. And 25 years ago, when I had 3 of these surgeries, it left me crawling on the floor for a month because they detached the muscle from the bone. I woke up from surgery this time with Dr. Garber, and I was walking in the hospital. When I woke up, the pressure was gone. It's not like Bonati when I woke up and they said it'll keep getting better. The pressure was gone when I woke up from Dr. Garber's procedure that was done like this, where they take the muscle from the bone, dissect the muscle from the bone. And so what they don't tell you at Bonati, as they're gearing you up for multiple procedures, is that every procedure leaves scar tissue. I'm sure you probably heard that before, but do you know what it actually means when they say it leaves scar tissue? It turns out that the scar tissue grabs everything, including the spinal cord. So Dr. Garber, the 3rd doctor who did the 5th surgery to repair 2 of the surgeries out of the 4 that Bonati did to repair them, he says that they had to remove scar tissue, and that I probably would have got a better result if I didn't have the initial 2 insults. This is the initial 2 surgeries to those spots because of the scar tissue. So they're here telling you about the laminectomies, the laminectomies, the laminectomies. They're telling you about the rods and pins and the hardware, and you don't want fusions. But meanwhile, they just, you know, and I'm not even sure if they had told me as many times about scar tissue, if it really would have registered, not just because of the pain I was in, because, you know, in an ambulance, I'm not doing surgery. In a hospital as a nurse, you're not doing surgery. And so I don't know what really would have registered, but I will tell you that as when they opened me up and they did this dissection on me on this 5th surgery, they also put in a device called a CoFlex, because one of the other things that they don't mention at Bonati is that you can get something called spinal instability. So you have your 2 vertebrae and you have the disc space right in between them. And so the disc holds them in a column right front to back, but there's also something called stability. And this is the spine shifting back and forth. And they don't discuss that with you either, because in the Bonati procedure, they can't add what's called a CoFlex, and that's a ring that goes around the vertebrae. So instead of a fusion where they bolt 2 together, which, listen, I would have been happy to get another fusion. I would have been happy for that. And so there's a CoFlex. This is a device that right there where you see it, right from here to here, it snaps in, wham, around it. And I'll show you what it looks like. I'm having x-rays created from all of the scans that I had done. I'm going to pull the most prominent x-rays for another video, and I'll show you what it looks like. But right here, they drop a CoFlex ring around the top and bottom, and this helps keep the spine from shifting left to right, front to back, and so it allows it to move positionally, the spine in relation to itself, but it doesn't. But it stops the shift, which also, you know, like imagine like, there you go. So you've got a foramen, a hole in your body, right? So you got a hole. If the spine shifts, the size of the hole changes. So you could be doing good. You bend over the side, you know, you twist a little, and the hole moves, and they stay in a different position relative to each other, and now you have a smaller hole opening. And this is when the bone gets bigger, it's they have to clear out the osteocytes. You get like the bone buildup, right? And so they have to, you can see in the video where they scrape the bone away, but they put a CoFlex in, and so there's no talk about a CoFlex when you go to Bonati. And so if you have spinal instability, I'm not sure if the Bonati procedure can even work, because while it may fix the bulge, it doesn't stop the alignment problem. It doesn't solve the alignment problem. It doesn't stop the shifting of the one vertebrae to the next vertebrae. It doesn't stop that shift right there. And so they're very limited in the information that they give you, both on the side of for and on the side of against. And you know, it isn't until you go to several doctors and you hear several different things, and then you get off the pills, which is 1,000 other videos all on its own, and they don't give you all the information. They just don't give you they give you enough information to lead them into their business. And you can't fault a business for that. I mean, that's their job, to stay in business. They didn't go in business to send all their patients to Dr. Garber, who did my 5th surgery and actually solved the problem. This is a fusion, by the way, that you're looking at. This is the plate. You saw the bone that they added in. This is a fusion. And a fusion restricts motion. It does. But those 2 vertebrae won't ever collapse again under normal conditions. I had a fusion, L4, L5, rods and pins, donor bone. I became a paramedic, 10 years or so after that surgery, lifting patients on the streets, off the ground, from behind the toilets, from inside the showers, from anywhere you could imagine. That was my job, and I did it with a fusion. So I was not afraid to get another fusion. But I understand not getting one, and I'm just saying that between the scar tissue and the choice between a fusion and a CoFlex, and what they can and can't do in Bonati because of the procedure and the way they do it, you can't get the CoFlex in that little hole. Was there less pain with the Bonati surgery than with the than when they dissected the muscle from the bone? Yes, but I got less results. I would have happily taken more initial pain to get better results, less scar tissue, a greater results, because the doctor didn't have to carve the tissue from the spinal cord to separate the tissue from the spinal cord. All right, listen, my name's Jason. I hope that this video helps you make your decision on what's the best medical care for you. And if Bonati works for you, listen, good for you. I hope that you get out of pain. I wouldn't wish what I've had to go through on anybody for any reason. And so I hope the best for you. And of course, if you want to see the other videos I have, just look up Never Bonati Spine. And later, when you see me, if you catch me on one of my live webcasts, you can always call in with the phone number right here. It's 844-769-2677 on a live webcast. And if you want to share your stories, you can always put them in the comment section. If you would like to share one of the problems that you've had, you can leave your contact information in the videos, and I'll reach out to you, and we'll see what we can do. But no matter what, listen, I wish you the best. I hope you resolve all the problems that you're having, and that you can get back to enjoying this life. Seriously, thanks so much for watching my video.